Hello, I'm Dr. Nitesh Khanide, consultant cardiologist from Chambers Clinic and Diagnostic Center. Many patients ask me a question, what are the diet that we should do? What is the lifestyle that we should do to avoid any heart problem? Let's see what are those. So first point, weight and shape. Dietary intake should influence the weight and shape of the body. The target BMI should be between 20 to 25. BMI more than 25 is not good for the heart. Hence always the plan and the ideal weight should be between the BMI of 20 to 25. After the weight, the ideal weight maintaining, what are the diet that will help in preventing cardiac illness? Fruit and vegetables, they are the major factor in the diet that will help in preventing heart disease. Increased intake of fruits and vegetables is associated with the reduced heart diseases, and this will prevent any blockages, any problems with the heart. So once we maintain an ideal weight, and then how do we maintain it? It is by the diet. So vegetables are there. Along with the vegetables, the fibers are there with the vegetables. This dietary fiber will help in preventing coronary artery diseases. A normal intake should be about 25 grams per day of fiber. This will help in preventing the heart diseases. Major source of fibers are your fruits and vegetables. When we select a diet, it's important to consider the glycemic index on the blood sugar. There are two types. One is high glycemic index, one is low glycemic index. So what is high glycemic index? High glycemic index raises your sugar very high and then it comes down fast. And the low glycemic index, the rise in the sugar is sustained and it is maintained and then it slowly comes down. So fruits with high glycemic index are not good. Fruits with low glycemic index is always preferable for heart patients. Now the next question will be, what are fruits or vegetables or things with low glycemic index? So barley has low glycemic index. Among rice, basmati rice has low glycemic index. Beans, lentils and breads that are made of whole grain bread, cereals should always be preferred over the other breads. And if you see the porridge, the yam, the sweet potatoes, they all have a low glycemic index, and this will help in preventing cardiac illnesses. Next is nuts. So what are the nuts that help in preventing cardiac illness? Peanuts, almonds, pistachio, all these things will help in reducing cardiac illness. So we should increase the consumption of nuts such as almonds, pistachio, peanuts in our diet. They help in reducing the inflammation and preventing cardiac illness. Salt is one of the major factors that can lead to cardiac illness. So always in our diet, we should try to reduce the salt as much as possible, because increased salt intake will lead to blood pressure, and then this blood pressure can lead to cardiac problems. Food selection is an important factor. Ensure that you are using plenty of vegetables, pulses and grain. Choose a leaner cut of meat and remove excess fat and skin before cooking any meat. This will help in reducing your cholesterol levels. If we summarize the diet, what are the cardioprotective diets? Fruits and vegetables. It's a cardioprotective diet which helps in reducing the cholesterol of the heart. Then low saturated fat contents, nuts, seeds should be increased in your diet. If you are eating bread, it should always preferably eat a whole grain bread. Then pulses, legumes, beans. These are all a cardioprotective diet and helps in preventing cardiac illnesses. Avoid oily food, avoid fry items how much ever possible, because this will lead to increased cholesterol and which might affect your heart. Thank you.